Okay, hello.
Hello,
Which state your name?
Geraldine Hagan.
Okay, Miss Hagan, my name is Trakessa. I'm going to be your nurse today. I understand that you're in the office today for respiratory assessment.
Yes.
Basically, what we're going to be doing, the respiratory assessment, we're going to be doing some tapping and some listening and so on and so forth. It doesn't mean anything is wrong. We're just going to give you a thorough respiratory assessment to make sure everything is okay and everything is accurate, okay?
Okay.
Alrighty. So basically, what I'm going to do right now is I want to kind of get a view, examine of your chest. I want to make sure your posture is straight, midline. Nothing is wrong with your breathing. I want to make sure that your anterior, which is your front, your posterior, which is the back, is transverse, which is anterior, posterior, and transverse. Raise up your arm for me. Transverse. Okay. Turn to the side for me, so I can make sure it's accurate. Anterior, posterior, and transverse. Okay. All right. Turn around for me. Okay. So I'm going to begin by looking at your scapula and your spine. I want to make sure it's midline, and midline is straight. Okay.
Okay.
All right. So my next thing, what I'm going to do is I'm going to check for the tenderness. So what I'm going to do is I'm going to put my hands side by side, and I'm going to go down your spinal cord midline. Okay. As I press, I'm going to be pressing, and if you feel any tenderness, just say yes or say no. Basically, what I'm going to do, I'm going to press. So we're going to begin. Okay. Feel any tenderness?
No.
You feel any tenderness?
No.
You feel any tenderness?
No.
How about right here? Any tenderness?
No.
Okay. Okay. Basically, what I'm going to do next is I'm going to check. What I'm going to do, like basically, it's like a touch. As you feel me touching, you're going to say 99. As you feel me touching the area, I'm going to do the same thing. Put my hands side by side. I'm going to go down your spine, and then I'm going to go transverse. Okay.
Okay. 99. 99. 99. 99.
Okay, so basically what I need you to do now, I want to check your symmetrical expansion. So what I want you to do is I want you to blow all your air out. Okay? And I want you to push some air out. Push your air in. Okay, great. Your symmetrical expansion is excellent. Okay, so now what I'm going to do, now I'm going to do some tapping on your lungs. And I'm going to go to each lobe, okay?
Okay.
Alrighty. And I'm going to start up here in these areas. Okay? And basically what I'm checking is the resonance, and I'm checking the vibration to make sure you have an accurate air, okay?
Okay.
Okay? Okay, on the other side. Okay? Alrighty. So what I'm going to do now is I'm going to have a listen to those areas. Okay, Miss Hagan?
Yes.
Alrighty. And what I need you to do is, as I have a listen, I want you to draw your shoulders to the front. Alright, thank you. And I'm going to begin up here. Okay. Okay. Okay, thank you. Can I have you turn around, please? And basically what I'm going to do is the same thing I did to the posterior area in the back. I'm going to do the same thing in the front, okay? And basically I'm going to examine your chest area, because I want to make sure that your breathing is okay. There's nothing wrong with your breathing. Your chest, everything seems midline. Your posture is straight and accurate, so we don't have any issue with that. So basically what I'm going to do is I'm going to do the same thing. I'm going to check for tenderness. Okay. Then after checking for the tenderness, we're going to move with the tactile minus, which we're going to be doing 99 as I'm touching. And then following that, I'm going to do some tapping. After I do the tapping, I'm going to do the listening, okay?
Okay.
All right, so we're going to start with, I already did the examination to make sure your breathing is accurate. So basically what I'm going to do now, we're going to do the touch for tenderness. So, any tenderness?
No.
Any tenderness?
No.
Any tenderness?
No.
Okay. Any tenderness?
No.
Alrighty. So basically what I'm going to do, I'm going to do the same thing, and I just need you to state 99 as you feel me touching, okay?
99, 99, 99, 99.
Okay, thank you. Now what I'm gonna do, I'm gonna do the tapping. Just like I did from the back, I'm gonna do the same thing in the front. Okay.
Okay.
Okay, thank you. So I'm gonna have a listen. Okay.
Yeah.
Alrighty. Okay, that's going to conclude our respiratory assessment. Do you have any questions for me, Ms. Hagan?
No, I don't.
All right, thank you.
Thank you.
I'm going to give a report on a 60-year-old female that came into the office for a respiratory assessment. And basically, what I began with was I looked at the contour and the configuration of her chest, which was straight. And her posture was straight and midline. I also did the inspection. I start off with the posterior inspection of her scapula and her spinal cord, her spine, which was midline and straight. I did the anterior inspection of her chest without the use of accessory muscles. Her respiratory rate was 18, unlabored. Following that, I did the vibration of the tactile minus. No rounding was noted to the chest. Following that, I did the vibration of the tactile minus, anterior and posterior. I also did the resonance noted percussion, anterior and posterior. Following, I did the symmetrical expansion, posterior, lungs, symmetrical expansion, posterior, lungs, bilaterally rising, lungs bilaterally rising equally, and also lungs are clear to auscultation